The most effective treatment for alcohol dependence, alcohol use disorder, and even drug addiction is by far and wide 12-step facilitation. And we know this because of the study and the evidence-based treatments. 12-step facilitation, when put against other counseling theories such as cognitive behavioral therapy and motivational enhancement therapy, actually outperform those and all others. And the reason why is because of its spiritual component, not religious, but spiritual component, and the ability for the substance user, the alcoholic, or even a drug addict to look at what they did to set the ball rolling and keep the ball rolling in a problem. When you think about it, alcoholics and addicts are notorious for blaming their problems on every other person, place, or thing. They're extremely selfish, they're resentful, and they love finger pointing, and they're angry. In the 12-step facilitation, you look at that and you address that. You know, when I go back to my studies and I look at psychoanalytic theory, which I found to be the most profound of all counseling theories, founded by Carl Jung, and Freud was in on that too, is that reminded me so much of 12-step facilitation, and not to mention that the founder, Bill Wilson, was friends, in fact, with Carl Jung. So when I look at today's counseling, it's been changed, it's been watered down. We perceive the client as a victim. There's not a lot of accountability. And when you go back to 12-step facilitation and you really dive into the book of Alcoholics Anonymous or even Narcotics Anonymous, it is by far and wide the most profound. And to kind of talk about this part, a lot of people tell me that their loved one hates 12-step, and I'm going to remind you, they do not hate 12-step. They hate what 12-step represents. They don't like the fact that they have to look at themselves and they have to look at what they did to wrong somebody else, and they have to make amends, and they do have to find a power greater than themselves, whatever that may be. So without question, 12-step facilitation is the most effective and profound, and it is in the evidence-based books and textbooks that clinicians study in graduate school and even PhD level programs. So if it made it in there and it outperformed CBT and MET, we know that it is the best way to maintain sobriety.